My name is Dr. Ssenyonjo Hussein. I am a neurosurgeon by training, and I have been working with this hospital case for close to 2 decades. The migraine is the most common type of headache in the world, and it is a headache that has specific characteristics. A migraine is a very severe headache using the international classification of headaches. So there are groups of scientists that looked at quite a number of headaches, and then they came up with a definition of migraine for as long as it fulfills any of the 5 characteristics that I'm going to talk about. 1, we use the rule of 5-4-2-1. 5 stands for the number of attacks that someone has had in their lives by the time they present to see the doctor. 4 and 3 stand for the duration in terms of hours. 4 hours to 3 days. You can turn the 3 days into 72, but for purposes of quick understanding, we prefer to use 3-4 days, but then 4 hours. And then the 2 stands for which part of the head is affected. Close to 70% of migraine sufferers, the pain tends to be on one side of the head. It commonly comes in the front, around the eye, or in the temples. In a significant number, it also goes at the neck, and that is the back of the neck. And then 1 stands for any of the, and still number 2, quite a number of people are very sensitive to light. They are very sensitive to noise. They are very sensitive to strong smells. So you choose any of those for as long as it is one-sided, and also there are aggravating factors like noise, like light, like strong fumes. Any of those, if you marry it with the one-sided of the headache, that is good enough to classify it also, pull it into the migraine group. And then lastly but not least, which is the one meaning that there are people who tend to have either eye signs like tearing or nasal irritation, or dizziness or nausea that accompanies that pain. Migraines are long-standing recurrent headaches. Long-standing, severe, recurrent headaches. And in most cases, unfortunately, people do not commonly respond to the common painkillers. Most of us have a headache and you take a Panadol and everything is okay and pain disappears. But in this category of people, it doesn't work that way. The pain tends to stay, even when you take the conventional painkillers. From the statistics of 2020, worldwide statistics for what has been captured over the years, I think the world is close to 7 billion in terms of population, and migraines affect almost 1 billion people in the world. What does that mean? Almost 1 in 7 people in the world have migraines. And that makes it a very important headache to talk about, because it is something that we see commonly in our practice. I think all doctors, junior or senior, in a neuro specialty or not, all of us at one time, we have treated or we are treating patients with migraines. There are some people some research that is still going on. Other people say there's a gene called the EAAT. In some categories of people, if you carry that gene, then the chances are big that you're going to have a migraine. But that is still something of contention right now. Not everyone believes that. But what we commonly know that we do not know why some people or most people get migraines. However, we see that if you come from a family that has migraine, so your chances of getting migraine are close to 70%. So that's why it tends to have a lineage into the family. So whenever someone comes in with a characteristic headache that I mentioned earlier, so we need to dig a little bit further into their families to see whether there is something that they can pick out as something that points to this long-standing, very painful, recurrent headache. Of course, most people, by the time they come to present to you, most of them deny, but we have seen others walking in with a few of their siblings who are able to point out to say, Auntie X, Mommy X, Grandma, Grandpa X has this problem. So yes, we see it in close to 70% that it tends to run in families. The other 30% we still don't know why it starts, and that is still something that science is yet to give answers to. Migraine, I always say it is a disease that tends to be like measles, like mumps, like flu. It is a disease of listening, and it's a disease of probing into understanding, especially the criteria that I told you about. So we always ask people, please help us describe the pain. What type of pain do you get? And the pain that normally people get is a throbbing headache like a hammer. And at times migraine may also mimic or may mimic diseases like bleeding in the brain. So at times when you're seeing them for the first time, you always worry that it may be a blood vessel that has given way. And we are always panicking not to miss that opportunity of diagnosis and saving someone's life. So quite a number, as we are running around, we go and try to find out if there is a bleed, and we don't find anything, then we zero on to a migraine as a problem. So if it's recurrent, if it's throbbing, if it's on one side mostly of the head, if it's aggravated or worsened by noise, by bright light, by strong smells, by anger, by hunger, by taking alcohol, because some people tend to think it's a hangover, by taking most of the sweet things like chocolate, by taking anything that is fermented. So if we have that criteria and someone says yes, 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 yes to most of that, coupled with the criteria of that I told you about 54321, and if we go ahead and do a brain scan and the scan shows nothing, then we are 100% sure that the disease that we are dealing with is a migraine. So we never fear to talk about migraine in people who have those characteristics with a negative CT. So it is a disease that is quite underdiagnosed, I think, in the country. But when you go to the States, I was reading statistics the other day about the States, that almost 1 in 10, I think, in males, and in females, and 1 in 30 in males tend to have this problem. So it is something that we should always make sure that we diagnose. And once you diagnose it, it is always easier to give the right information about how to prevent it. It is a disease that doesn't have a cure, but it's a disease with the right information that we can try as much as possible to prevent, especially on the recurrence of the symptoms. Migraine has characteristics. One, it is a very severe headache. Very severe headache. Number two, it does not at all like noise. Most of the people, even the click of a second hand of a clock is just enough to cause irritation to someone to say, please move away. It is a headache that does not like light. So most people always say, if they're in a room that is lit or with the light on, they always tell you that please switch off the light. If they have children, the worst that they want is any screaming around them. It is the only disease that behaves that way. And that's how we commonly tend to differentiate it from other forms of headache. If I have stress, yes, most times the noise may not necessarily affect me. Light will not affect me. You find that some other people, especially at night when they are driving, even driving becomes a problem because of the light. Whenever someone puts on the headlights on full, that can trigger off the pain. So it's a disease that has unique characteristics that other headaches do not have. Yeah, we always say migraine. When you have a migraine, we always tell people it's first treat it like a normal headache. When you're home and you're in pain, we always say begin with a Panadol, paracetamol. It's readily available in close to 70 people. It may bring your pain, let me say, from 10 over 10 or 100%, about 50%. So that shoot down is also not so bad. At least someone can have a little bit of rest. If that doesn't help, then drugs, especially like ibuprofen, are what we call the second line drugs. Beyond the second line, we always tell people that we would prefer that you get to the hospital and allow now the doctor to take over in terms of advice and the rest of the drugs that you're going to do. So in terms of drugs, paracetamol, ibuprofen, these days the combination of the two drugs, those should always be the first remedy at home. Beyond that, then it will be better that someone comes into the hospital to seek advice from a medical person. I think in the interim, the answer is yes, but if you see that you're biting on the pill every single day, it means that there's a problem. So that's why I'm saying if anything persists beyond 3 days, please move. It only means that you're having a problem. Because yes, we know that migraines, as I said, the pain can stay on even up to 3 days. Some people even more. We've seen people who are weeks into pain. We have seen people who are close to a month with pain all the 30 days. So we always say that by the 3rd day, if your pain is still on, if your pain is very severe, it's not allowing you to do your work and all that, please get into hospital to seek medical advice. The answer is yes. So that's why there are diseases that almost present like migraines. And especially there are people who get their first attack and they're in hospital. Because it may be the first attack and it doesn't feel the rule of 5, 4, 3, 2, 1 that I mentioned earlier. Someone just gets a very bad headache and that is the first time that you see them in hospital. We fear those ones so much. What we always do, yes, we go through the history taking. At times the history taking, I mean the history is very short. We do the physical exam and then we try to find out if there are any other signs that can give you a lead on to any of those diseases. Even if the signs are negative, you still want to go ahead and find out what else is happening. One of the things that may give you that, it can be a tumor of the brain. It can be an infection of the brain that is beginning to happen. It can be bleeding into the brain. All of us have normal circulating water within the brain. Anything can start interfering with the circulation of that water. And then you end up having accumulation of this fluid in the brain, and then it gives you a sudden onset of these headaches. So there are many other things that you really have to rule out, especially in those that come in within a very short period and they have not yet fulfilled the criteria that I talked about of 5, 4, 3, 2, 1. So those ones, we must be very careful with them and make sure that we investigate them. Yes, we also see those that come 30 years down the road that have been having headaches for 30 years. Those ones, most of the times, we don't panic so much, because if there was anything in 30 years, if it's a tumor, you can't live on for 30 years. It would have killed you by then. So there are those that make us run very fast, especially if they come within, they say this is the first attack I've had in my life. Then there are those ones that you can basically treat based on symptoms and not panic to do a scan, because their symptoms may have been decades before they come to see you. So maybe the other thing before we finish, we need to talk about the triggers of this. What are things that may switch on the pain? There are things that we find in dietary. In the dietary, I mentioned alcohol. I mentioned citruses. Citruses are okay. Citruses are oranges, mangoes, tangerine. You can still take them. But we only say the volume, anything more than 50 mils will be a problem. We said take little. Chocolates or anything sweet, especially when you have pain, please keep away from sweet stuff. You know that young people especially tend to have this sweetness, sweet tooth, that what other people tend to call the sweet tooth syndrome. So not knowing that will give trouble. Heavily spiced meals or foods, because of chemicals of tyramine and nitrites, those can give you trouble inside there. If one does not rest enough, then we normally say 7 to 8 hours is what the brain needs. If you have a tendency into migraines, whenever you cheat the brain in terms of sleep, it will give you a symptom of a headache. So until you give it back what it needs, the pain may not go away just with medication. Until you give it back its hours of rest. We talked about dehydration, people who don't want to take water. As we always say, water is life. So if you see a kidney specialist, he will tell you that the best that you can do for your kidneys is taking water. I also say the best you can do for your brain is taking water. So as the saying goes, water is life. So water is needed everywhere. Any dehydration will switch on pain. So we always tell people, when you have this pain at home, when you take a Panadol or Brufen, just go ahead and also make sure that you drink enough water. That may be good enough to take away your suffering, and you don't have to come into hospital. Maybe the other thing I didn't mention, that migraines tend to be more common in females than males. We still don't know why. So at times we see females who come and then they have tendencies of having these pains around their ovulation or around the time of their menses, and then once that is gone, the pain will disappear, and then it comes back around the same time in the next month, what we call menstrual migraines. So yes, the others will have to look into those clear characteristics in their diary and try to follow up if their pains just fall within those periods of the cycle, and then we are able to know. Even when you come to us to see a doctor and you're female, we still go a little bit deeper into asking about some of those things to try to understand. It helps us in when the intervention should be applied, especially if they are drugs. Since I said that migraines is a disease that we cannot cure, we always have to rely on prevention. And that we do a lot of education. Here at the hospital, we have some literature that people carry home with them to try to empower them or stimulate them to read further. In the world, there are associations for migraine sufferers where people sit and then they discuss about their condition, what works for them. Because what we know about migraines is what works for one group may not necessarily work for the other group. So we also encourage some people to join these clubs, so that some people can teach them how to cope up with some of these problems and to avoid biting on a pill all the time. So the best treatment for migraine is prevention, and when you come over here to the hospital at CASE, we always emphasize one thing, is how to prevent. Make sure that you reduce your hospital visits, and also to make sure that we protect your liver from daily medication. Ladies and gentlemen, I am happy that the knowledge that I have, I've been able to share. For the parts of the subject that I haven't been able to touch, I think whoever needs that can come to consult. We have quite lots of information. We can also hear from you how you have been coping up. Migraines are things where we learn back and forth from even the sufferers in trying to understand how they cope up, and this helps patients a lot, especially in reducing their hospital visits as much as possible. So I would like to thank the host for the day, and we are always here to serve whenever someone calls on us. Thank you very much.